Rising cases and fewer workers have Mississippi hospitals in crisis mode. Another factor in the overrun is how long it takes for COVID patients to recover. WCBI's Stephen Pimpo has the story.
Just a lot of very sick people. We're seeing increased number of patients presenting with COVID signs and symptoms. Some of them are really critically ill.
That's the situation doctors and nurses are facing at OCH Regional Medical Center and nearly every other hospital in Mississippi.
As of right now, most hospitals in the state are at capacity for ICU patients. So we're really jumping in together and trying to take care of these patients best that we can with our emergency department staff as well as ICU staff.
There hasn't been an open ICU bed at OCH Regional Medical Center during the month of August, and the majority of those beds are holding unvaccinated COVID patients.
COVID is kind of a lengthy disease. It's something that can take as much as 3 to 4 weeks. A lot of times patients might have to be transferred to a long-term acute care facility if they're on the ventilator for a certain amount of time.
OCH's emergency room and ICU director Jacob Leggett says his team of nurses are all qualified, patient-oriented, and dedicated to providing the best treatment possible. But with the lengthy recovery time COVID patients face, an already depleted healthcare workforce is being pushed to the brink.
Right now we are currently full. We're holding critical patients in the emergency department.
Now the University of Mississippi Medical Center warns the public that the state's entire hospital system could be days away from failure. The best way to provide relief for Mississippi's beleaguered doctors and nurses?
The vaccinations, protect yourselves and protect your family.
In Starkville, Stephen Pimpo, WCBI News.
The Department of Health reports 90% of all COVID-19 hospitalizations in Mississippi are unvaccinated patients.